We hosted a series of workshops at the Thackeray Medical Museum in Leeds, which connected academics from a wide variety of disciplinary backgrounds with health professionals, patients and carers to explore what we can learn from current and past developments in advanced wound care. The focus was on innovation in the wider context of the history and sociology of wound care.
I think this project's been fascinating because I've learnt to consider wound care from a much broader perspective besides my own discipline of nursing.
I've learned a great deal about the contemporary environment in wound care, what products are being used, how effective they are and how they're being regulated and controlled. As a historian, it's been incredibly helpful to see just how these products are developed, manufactured and sold to consumers, and having the contemporary perspective has allowed me to reflect a great deal on the way that I conduct my own research.
What I've learned from beyond my own discipline by participating in these workshops is the deep historical context of wound care.
The industry commentary that we've had from colleagues has really again given a different perspective. I look at it from a healthcare perspective, but from industry we've very much seen it's from the profit perspective and the shareholder perspective. So everything together, it's like a jigsaw all coming together, which has been fascinating. We've talked about the beginning, we've talked about the history this morning and the traditional approaches to wound healing, and many of you will have seen this picture called Wound Man. Now I've picked this because this picture appeared on a document that got my interest in wound care.
I think the next place that wound care should go is talking much more to patients and having a dialogue between patients, doctors, nurses and the people who are making the medical devices. I think that's what's missing in the current wound care landscape.
There always feels like there's a lot of products coming out on the market, but they always seem to be doing the same thing.
And we're faced with a huge range of products that we can use. The question often is, how do we select which product to use when?
We've got guidelines that say that we should use clinical judgment when we're selecting products, but we haven't got a lot of very good evidence in the field at all to support those choices that people are trying to make.
I think wound care next should actually start to focus on the patient, because I think the reality is that the NHS is struggling to cope with the demands of healthcare in general and wound care specifically.
I think the wound care should go towards evidence-based treatments.
Thinking about the future of wound care and where it should go next, I think one of the things which is starting to change but we could do more of is thinking about how we involve patients in wound care. So I think at the moment it's still something which is often done to patients rather than something that they're part of.
But there's also a lot of research which is very much led by clinicians and what they think needs to happen, or by academics. And it's starting, those two worlds are starting to come together a little bit now. So in research which is traditionally more clinically led, like trials for example, researchers are starting to try and work a little bit more collaboratively with patients.
At the moment, nurses aren't delivering wound care as they were 20 years ago. So I think in the future, wound care will need to be patient orientated. It's about self-care. And I think we'll see over the next 10 years a gradual shift from wound care was delivered by health professionals, it's now delivered by healthcare assistants, and in the future I think it'll be delivered by patients.
So a prime example of that is pressure ulcer prevention. So I've spoken to lots of patients who didn't realise they were at risk of getting a pressure ulcer until it had already happened, and actually if that conversation had been had with them, then they might have been able to help prevent it.
So let's talk about pressure ulcers. Now, as we all know, we can look at pressure ulcers in different ways. And one of the approach from a bioengineering point of view is to do what we call a lab to patient-based study.
I think the subjects that were particularly successful were discussing the ways that these products were used by nurses. I think it's the everyday aspect of wound care rather than the technological innovations or the scientific understanding of wounds, which has been particularly revealing and interesting.
And these were things that we used every day. Now it might not have been for wound care as such, but actually it was about skin care and protecting patients from developing wounds. And these were things that we used very much to prevent patients getting pressure ulcers.
It would be nice to think in the future that we would have a closer dialogue between histories of wound care and contemporary practices, and I think that that's something I'd be very interested in pursuing in the future.
The way that everything used to be directed at doctors, it was all about doctors, and now wound care is a completely nursing-led thing.
The collective views that we've brought together are starting to show us where we need to go, and that's really about patient focus. How is the patient going to care for their own wound in the future? And I think industry and the healthcare professions and the other disciplines have a lot to offer in showing us a way forward.